welcome to the next episode of the Hormone Café. Today we're going to talk about PCOS, which stands for Polycystic Ovarian Syndrome. I think PCOS can be really confusing, so I'm so excited to talk about it today. We're going to go over what is PCOS, how do you diagnose PCOS, what are the medical management options, and then what are the surgical management options. Technically, the definition of PCOS, or polycystic ovarian syndrome, a lot of people use a criteria where you have to meet one of three things, meaning you either have to have irregular cycles, or you have to have high androgens, for example, high testosterone, or you have to have polycystic ovaries on an ultrasound. So if you meet two of those three things, technically you meet the diagnosis of PCOS. What PCOS is when your ovaries start having a lot of hormone dysregulation. So if your ovaries aren't able to make hormones properly, or your brain is not talking to your ovaries properly, then they start making hormones improperly. And this has a lot to do with our insulin levels, our blood sugar levels, because a lot of people with PCOS, they have insulin or dysregulated blood sugar levels. And then when we think about cysts on the ovaries, I think PCOS is actually a really terrible name, because when you think polycystic ovarian syndrome, you think of an ovary with a whole bunch of cysts on it. But it actually should be called polyfollicular ovarian syndrome, because it's not that your ovary has a bunch of cysts, it's that it has a bunch of follicles. So why does your ovary have so many follicles? In a woman that doesn't have PCOS, let's say you're recruiting 5 follicles that month in order to get one dominant follicle to ovulate. In a woman with PCOS, they might recruit 10 or 20 follicles that month in order to get one dominant follicle to ovulate. So instead of having a bunch of cysts, they actually have a whole bunch of follicles. And their brain can be trying really, really, really hard in order to ovulate. So it's making all of these follicles in order to try to get one follicle to become the dominant follicle to ovulate. That's why women with PCOS tend to have enlarged ovaries, because they're full of a bunch of extra follicles. But then all those follicles can cause a lot of hormone dysregulation. So the brain has to work really, really hard, make a bunch of follicles. Either you are ovulating late, oftentimes if you have PCOS, or you aren't ovulating at all. And then that lack of hormones gives feedback to your brain, and it makes a little bit of a vicious cycle. So PCOS is really a hormonal imbalance where your body is making a lot of follicles in order to get one to ovulate. I think one big component of that is when you have PCOS, you can feel really fatigued all the time because your poor body is in overdrive working really hard in order to ovulate. And then when we think about other criteria of the diagnosis of PCOS, technically you have to have 2 of those 3 criteria that we talked about, either irregular cycles, high androgens, or PCOS ovaries. But some of the other softer markers of PCOS, if you have a really high AMH, for example, which stands for anti-Müllerian hormone, we think of an anti-Müllerian hormone as an egg quality number, but it gives you a sense too also of how many actual follicles you have. So sometimes when you look at an anti-Müllerian hormone and it's above 3, that can be a sign of PCOS, because remember how we talked about your body has to make a whole bunch of follicles in order to get one follicle to be the dominant follicle? Well, all of those follicles make extra AMH. So if you have a really, really, really high AMH, greater than 10, greater than 12, it can mean really severe PCOS, meaning your body has to make tons of follicles in order to just try to get one to ovulate. Or if you have an elevated LH to FSH ratio, so when you get your brain hormones checked, oftentimes I check them on cycle day 3. You want to make sure that your LH and FSH are really close to the same number. And people with PCOS, remember how we talked about your brain has to work so hard in order to ovulate? That can be reflected in a really high LH number relative to your FSH. So those are some of the lab markers that we see that can hint towards PCOS, in addition to having high androgens, so something called a DHEA, that can be high, or your testosterone can also be high. I think sometimes, though, when you get diagnosed with PCOS, you Google it, and it's really easy to get boxed into one specific thing. There's many different types of PCOS. Not everybody, for example, has acne. Not everybody has hair growth. Some people do, some people don't. Some people have high testosterone, some people don't. Some people have insulin resistance, some people don't. So I think one thing that's really important, in addition to just knowing whether you have PCOS or not, is knowing what kind of PCOS you have, right? Do you have a high androgen version? Do you have a version where your ovaries are enlarged? Do you have insulin resistance? Because those specific things will enable you to tease out a really specific treatment instead of just generic treatments for PCOS. So if you have PCOS and you have a sense of your hormone profile and your metabolism, let's talk about the options for that. Like, what do you do if you have PCOS? Of course, everything that we do is always foundational with nutrition, exercise, stress, sleep. So when we think about a PCOS diet, a lot of hormone dysregulation can be mediated by eating a lot of sugar and a lot of carbohydrates. I had a patient the other day who has very, very severe PCOS, and I asked her how she ate as a child, and she said that she tended to be a really picky eater, ate a lot of carbohydrates and a ton of sugar, and that can actually fuel PCOS. So how you've been eating your whole life, how you've been eating as a child can fuel PCOS that you have in the future, because all of that insulin or all of that glucose can really give your body a hard time making hormones in proper amounts and can grow your ovaries and grow those extra follicles. So one thing that's really important when you have PCOS is being on a really low sugar diet, which sometimes is really hard to define, but what you want to think of it as 80% of your days, you want them to be savory, meaning you don't want to add sugar to your life every single day. If you want to have a treat, you can only have it 1 or 2 days a week. So 20% of your days you can have a treat, and 80% of the time you want to be really savory. That's what a low sugar diet looks like, meaning you're not adding extra sugar to anything. You're not putting honey in your tea, honey in your coffee. You're not having dark chocolate after dinner every day. You're only doing that 1 or 2 days a week, because decreasing your blood sugar will really, really help with your PCOS. Another thing you really don't want to be doing is things that also have sugar in them. For example, coffee creamers, soda. You really want to do a sugar audit and get a sense of how much sugar are you actually having in a day, and just save your sugar for 1 or 2 days a week. So that's one big thing. The other thing that you want to be doing is cutting out any white, refined, bleached, or enriched carbohydrates. So for example, you don't want to be doing white bread, white rice. You don't want to be doing white flour tortillas. You want to convert all of those things into long grain, whole grain, brown rice, wild rice, because that will really, really help actually heal your PCOS. You want to have more complex carbohydrates and not simple carbohydrates. So we want to convert our carbohydrates into whole grain, high quality sources, and then we want to cut sugar out to only 1 or 2 days per week, and that will really, really help as far as when we think about PCOS. The other things that we want to be thinking about, and generally you want to be getting about 25 grams of fiber a day, and so you want to get that in a combination of seeds. So flax seeds is a good example, vegetables, especially green vegetables, and then high quality grains like we talked about, and then beans. Those are just amazing, diverse sources of fiber, because fiber will help you clean out your colon and help you metabolize your glucose better. So our diet is low sugar, non-low carb, high complex carbohydrates, and then lots of fiber. And of course, you want to be drinking a lot of water, because that will also help you regulate your glucose. And then when we think about, okay, so we have our, PCOS diet, and then other things that people who have PCOS, they have to keep everything in their life really stable. So I talk about the 6 pillars of hormone balance. The 6 pillars of hormones are diet, stress, sleep, exercise, weight, spirituality, and mentality. So if you have PCOS, you're a person that has to keep everything in your life very, very regular. You're not going to be one of those people who is going to be able to travel and eat differently and be super stressed. You're going to have to, if one of those pillars of hormone balance is off, like maybe you're stressed because you're traveling, all the other pillars you're going to have to keep stable, meaning you're going to have to eat 3 times a day. You're going to have to go to sleep. You're going to have to get a good night's sleep. You're going to have to move your body. All of those things are really, really important, because if you have PCOS, you're just not going to be able to get away with ping-ponging back and forth between different things, like staying up really late and then sleeping in on the weekends, or being super duper stressed out and then being relaxed. You have to keep everything in your life really, really balanced. So routines are really important. You're going to want to make sure that you eat a high protein breakfast, eat lunch, eat dinner, eat a high protein snack in between lunch and dinner, go to bed at the same time every day, wake up at the same time every day, move your body at least 15 to 30 minutes every day, and just really, really keep those routines, because that is how we're going to manage and heal your PCOS. Don't care about your friends. Don't care about what anybody else is doing. Know your body and know what it needs, because we all know those people who stay up really late, they don't eat great, they're super stressed out, and they have perfect hormones, and they don't have any complaints. Don't worry about those people. That's not you. That's not your body. Do what your body needs. Learn about your body and learn how to love and nourish it. So when we think about PCOS, you really have to think about those 6 pillars and how to keep them all balanced every single day. So as far as when we think about managing PCOS, that's the core. And then the second thing is supplements. So what kind of supplements do we need in order to help manage our PCOS? I think the most common one that you'll hear is something called inositol or myo-inositol. Myo-inositol is lovely. It's especially good if you have irregular blood sugar or you tend to have insulin resistance. That one's lovely. All the other supplements I definitely base on your hormone profile and your symptoms. For example, if you're a type of PCOS that has high testosterone, then we need to be thinking about how do we get your testosterone down. If you're a type of PCOS that has low estrogen, then we need to be giving you supplements to boost your estrogen, like an omega-3, for example. So some of those supplements will really depend on your hormone profile. And then other kind of things that I often do are, I often have people who have PCOS do continuous glucose monitoring, because it's really, really helpful to learn about your blood sugar, learn if there's any foods that are spiking your blood sugar, learn what your average blood sugar is, and if you have insulin resistance, because some people with PCOS, they have completely normal blood sugar. Well, as part of the healing protocol of your PCOS, blood sugar is not necessarily something you're going to focus on if you already have a normal blood sugar. But if you have a high fasting blood sugar, for example, your fasting blood sugar is greater than 95, or you have multiple foods that you're eating that are spiking your blood sugar higher than 140, then yes, a big part of healing your PCOS is going to be keeping your blood sugar stable, bringing down your fasting blood glucose, and making sure that you're not eating anything that's spiking your blood sugar. So I love when people do continuous glucose monitoring. It's very, very helpful to learning about that metabolism piece of your PCOS. And then the other thing that you should know is there's also a surgical option for people who have PCOS. How we talked about, a lot of times people with PCOS, they tend to have very, very enlarged ovaries, which means that they have all these follicles and they have way too many follicles. So people like me who do restorative reproductive surgery, we can do something called a wedge resection. So what we do is we take an enlarged ovary and cut out a little wedge out of the ovary and then sew the ovary closed back to its normal size. And a lot of people say, well, that sounds scary. I can't believe you're going to take a piece out of my ovary. That's terrible. But you have to think, when your ovary is enlarged and has way too many follicles, it's in a way sick. Like, it's not able to make hormones in proper amounts. So we can take out the follicles that are sick and restore you back to a healthy ovary. A wedge resection is one of the most successful surgeries that I do. I had a patient who I just did a wedge resection on, and she wasn't having any periods at all. She would never have a period unless it was induced by progesterone. And she had a really high AMH, or an anti-Müllerian hormone, and really enlarged ovaries. And I went in, I did a wedge resection. We took her AMH from 14 to 4. So now her ovaries were able to make hormones in proper amounts. And she had a period every 30 days. She ovulated on cycle day 16. And she said, Dr. P, I love you, but I do not need you anymore. Like, I am ovulating. I'm losing weight. I don't have acne anymore. And she graduated from her office because she doesn't even need to see me, because now her periods are regular and lovely and she doesn't have to take any medication at all. So if you're someone who you feel like you're just hitting a wall with PCOS, you've done literally everything possible, you've done the diet, you've done the supplements, you cannot lose weight, your metabolism is not budging no matter what you do, a wedge resection can be very, very helpful, because we can take the piece of the ovary that's a bit sick out and restore you to your normal, healthy, beautiful, and lovely ovaries so that they can make hormones properly and ovulate without trying so hard. So oftentimes you can have a much better mood because now your hormones are regulated, you're ovulating regularly, you're having a period every single month, and you have more energy because not only is your body able to make hormones, but your body doesn't have to try so hard every single month in order to ovulate. So if you're a person who suspects you might have PCOS, please get tested, get your blood work drawn, get an ultrasound of your ovaries, and keep track of your cycles so you have a sense of how regular or irregular they are. Kind of understand which type of PCOS you have, what your estrogen, progesterone, and testosterone are doing, what your glucose and your metabolism are doing, because you can heal your PCOS. You can heal it so that you have normal blood work, normal size ovaries, normal labs, and most importantly, that you have a cycle every month, you ovulate every month, and you feel amazing and have lots of energy every single day. If you would love to come to us, our clinic is in Denver, Colorado. Please come and get tested. We'll see if you have PCOS. We'll make an excellent management plan to manage it no matter what, and do not give up on your body. And next time we'll be talking about ovulation. What is ovulation? How you know if you're ovulating? So thank you for joining us, and come with us on the next episode of the Hormone Cafe.